and so probation personnel. And I do want to thank probation personnel that work here. They work with our kids in a
Good afternoon, everyone. Thanks for joining us on the media briefing on this beautiful Wednesday. We had a slight update to our agenda, which I sent out earlier, and we're hoping to have Dr. Deneen Gus, our superintendent of schools for Monterey County, on the line. And I'm seeing someone from MCOE, but Dr. Gus, do I have you on the line this morning or this afternoon? Not yet. So I see, Jessica, you're on the call. Is Dr. Gus going to be able to join us shortly? Can you unmute? So I'm not seeing Dr. Gus, and I'm hoping that she will join us shortly. I know she had a short time frame, but in the meantime, perhaps we can go briefly on to one of our other presenters. Diana Jimenez, I see you're on the line. Are you able to give us an update on Great Plates? There's some great news you've got today.
Yes, Maya, thank you so much for this opportunity to share some updates. So the Great Plates Delivered program was extended by FEMA through March 8th. And just as a quick reminder, the Great Plates Delivered program is, or the goal of it is to help seniors 60 and over to stay healthy by and shelter in place by providing them 3 meals a day. The second part of it, or the second goal, is to provide some economic stimulus money to local businesses that are participating in this program. So to this end, and since its inception in June of last year, we have provided over 156,000 meals to seniors, and we average about 300 seniors per month that we serve 3 meals a day. We have provided over $3.6 million in stimulus money to the participating restaurants. This money is 93.75% reimbursed by FEMA and the state. So FEMA reimburses us 75% and the state 18.75%. The dilemma we have is that they don't notify us until the very end of the month in regards to whether it will be extended or not. So it's a month-by-month program. We're hoping it will continue as long as the pandemic exists in our area. The second good news that I have is that on February 9th, the Board of Supervisors approved the restart up of the AAA Cares Meals program. This is a parallel program to the Great Plates Delivered program and helps seniors who don't meet the income criteria or other criteria that it is set by FEMA for eligibility for seniors. So it really does help reach seniors who otherwise would not be eligible for Great Plates Delivered, to help serve them 3 meals a day so they can also shelter in place. It's also going to provide some stimulus money to local restaurants that will participate in this program. It ended in December due to state funding ending, but again, with local Board of Supervisors support, we're hoping to restart it either later this month or the beginning of March. We just need to set up all the contracts. We're hoping to serve an additional 120 seniors that need us. And as we know, hunger is everywhere, from families with little ones, and our senior population is no exception. And so helping to do 2 things. One is help seniors stay healthy, but also minimize hunger among our senior population. And then second, providing some stimulus money to struggling businesses really is the goal of both of these programs. And I think that's all I have for now.
That's so great to have some good news on these wonderful programs. If you could stay on the line for questions after we finish, everyone, that would be wonderful. We've got Dr. Deneen Gus on the line with us now. We're really grateful she could squeeze us in today to give us an update. There was a lot of news out yesterday about the reopening of schools, and I'm hoping you could share some information with our participants today.
Absolutely. Happy to be here. Thank you for the invitation. So yes, we did receive great news yesterday, or I should say, yes, that was yesterday. Oh my goodness. The days
Seems
are
like a week ago, right?
It does. But when we heard the news that we are now below 25, that was great news for us, because that now means that schools that want to reopen, or I should say elementary schools, kindergarten or TK through 6th grade, can reopen to in-person instruction if they have an approved CSP, which stands for COVID Safety Plan, in place. And the COVID Safety Plan also contains a CPP, which is the COVID Prevention Plan that addresses the health and safety protocols for all of the adults that would be on campuses. So if they have the approved CSP, they can open their schools to in-person instruction. And what we're talking about here is really that hybrid model. And we are only talking about elementary grades at this time. So the way it works is they submit their CSP to the local health jurisdiction and to the state's Safe Schools for All team. The local health jurisdiction and the state's team have 7 days to review that plan. If they find anything in the plan that they believe needs to be addressed or changed, they'll reach out to the school that submitted the plan, work with the school through making those changes or those adjustments, and then the school can reopen. If there are no deficiencies in the plan, then after 7 days, the plan is either approved or considered approved if they have not been contacted by the local health jurisdiction or the state's Safe Schools for All team. And then on the 8th day, the schools can reopen. Now, even though that's very exciting news, I do just want to caution everyone to understand that schools are all in different places right now, all over the county. And what I mean by that is some are more ready to open than others. If they have been doing behind the scenes planning up to this point and working with their union partners, they may be able to open more quickly than schools that are just now starting to work with their union partners to put their plan in place. So that's pretty much where we're at right now. And with that, I'll open it up to any questions that you may have.
That's great. Thank you very much. And again, thank you very much for squeezing us in today to talk about this. I know for a lot of families and parents, this is such an important topic. So this is the time for questions for Dr. Gus, and I've got one for you in chat. And then if anyone else has questions, please go ahead and send them now, and I'll read them for the benefit of those who are not on the Zoom call. Dr. Gus, for you, any update on which districts have officially applied to reopen as of yesterday?
So no, I do not have that information as to which districts have applied. I do know that several districts are planning to submit their CSP. We do have one district that had already been approved on a waiver, and then the waiver process went away and that school had not yet opened. So that school district is probably better positioned to reopen soon. But it would be up to Dr. Moreno to approve that CSP plan prior to them being able to reopen. So I'm gonna ask Dr. Moreno if by any chance that school district may have already submitted their CSP. That would be Carmel. Dr. Moreno, are you on the call?
Yeah, good afternoon, Deneen. Hey, Maya. So we do have a, as I understand, situation that's different than that has replaced the waiver system. And, but in the new system, the state does acknowledge that if school's already open, was previously open and they're in the purple tier, that they need to post their COVID safety plan on their website. And any school that wasn't open is then can reopen. And those schools also, as Dr. Gus mentioned, need to submit their plans to local health jurisdiction, in this case, Monterey County Health Department, and to the state. So we have a mix of situations here, mix of those that were already open and those that were not open. Dr. Gus was talking about the one school that applied that under a waiver who was approved and didn't open, and that was Carmel Unified School District. But they did submit their COVID safety plan, which includes checklist and the prevention program. So they've submitted. I don't know when they plan on opening, but one more caveat about this new procedure for opening and reopening, and that is a school who's not currently open but eligible to reopen after meeting the requirements that Dr. Gus mentioned has to wait in that county, the school can't reopen until the adjusted case rate for the county is below 25 per 100,000 for 5 consecutive days. So there's Carmel Unified School District did submit, and everything seems to be in order. And if they want to open, they can open as early as, I believe, Monday, because that'll be 5 days from the date that the state posted our case rate as at less than 25. So that was Tuesday. So 5 days from Tuesday is the earliest they could open, which would probably mean Monday. But then next Tuesday, the state will release our updated weekly adjusted case rate. But the way the trends are going right now, it doesn't appear that our case rate will go above 25 next Tuesday.
And just for clarification, once a school district submits their CSP, there's a 7-day period in which that plan is being reviewed by Dr. Moreno and by the state's Safe Schools for All team. And then it would be the 8th day they could reopen. Now, if they didn't reopen and the metrics go the wrong direction, then they won't be able to reopen. If they're open, and because the metrics are still where they need to be, and then after they've reopened, if the metrics go the wrong direction, the schools are allowed to remain open if they were already open. So that's an important piece. I can also tell you that there are other districts that are now beginning those conversations, again, with their union partners and all of their stakeholders. They're working on their CSPs, and they will be bringing those, to their Board of Education for final approval before submittal to the local health jurisdiction and the state's Safe Schools for All team. So those plans are underway, but at this point in time, I cannot tell you exactly which districts will be opening or when they will be opening. I can just tell you that those conversations are happening at this time.
Thank you. And I think you just answered a question that we had in chat about if the county goes above 25 over 100,000, what will happen to schools that have reopened? And the answer is they are able to stay open, correct?
Correct.
And no one has asked this, but I am wondering if people might not be wondering how extensive is a CSP? What are some of the components that have to be in that CSP?
Oh, that's an excellent question. So the COVID safety plan, also known as a CSP, outlines all of the health and safety protocols that a school would follow prior to reopening. So it will outline what PPE the schools will be requiring. It will outline the health screening that will take place. It will outline where they're going to eat lunch, how they're going to eat lunch, where they will play on the playground. It will outline all of the social distancing protocols that students will have to follow, and just make it very, very clear so that when students and staff do return to in-person instruction, they know what to do, they know how to stay safe, they know how to ensure that they're properly social distance, wearing the right PPE, and washing their hands regularly. So it's very extensive. And I can tell you that schools have been working on various components of that plan I want to say right after the schools closed in last March, the schools were already trying to put in place all of those mitigation strategies so that when the time came to safely reopen, they would be prepared to do so.
Thank you for that. And thankfully, Jessica Hull from your office put into chat the checklist, a link to the checklist for those who are interested in taking a look at that and seeing what those components are. I don't have any other questions that have come in for you.
Great.
Giving it a second here. And so we'll be able to let you go now. Thank you so much for being able to join us and drop in and give us this important information.
Happy to be here. Thanks so much for the invitation.
Thank you, Dr. Gus. And so now we'll move on to some other good COVID news. We've got Jason Cameron and Jack Murphy from our Military and Veterans Affairs Office. They're going to talk a little bit about Veterans Administration COVID clinic that happened this past Saturday and about good news about an upcoming clinic. Good afternoon, gentlemen.
Good afternoon, Maya. Thank you so much. I'll go ahead and go first, and we'll kind of flip it a little bit, and I'll talk about the upcoming stuff, and I'll let Jack talk a little bit about what had previously happened with the COVID clinic. Now, over the past several weeks, we've been working very hard to get the Moderna vaccine down here to the VA clinic in Marina and have successfully done so, which is just fantastic. Before, veterans had to travel, a couple hours one way in order to get the Pfizer vaccine. So this Moderna vaccination being able to be administered here is just a tremendous win for the veterans of this county, and it's absolutely because of the joint push from our office, the Military and Veterans Affairs Office, the County Board of Supervisors, as well as the Congressman's office, Congressman Panetta. Really, the trifecta of effort. So we had the initial 600 doses came in for Moderna. Those were administered last weekend. And then now we've also gotten an additional 400 doses have been allocated and will be administered on Thursday, February 25th. 400 additional Moderna vaccine doses have been allocated and will be administered on the 25th. Now remember, veterans must be enrolled with the VA healthcare system, and the eligibility requirements for this vaccination on the 25th is high-risk veterans, beginning with homeless veterans, veterans on dialysis, transplant veterans, chemotherapy patients, and veterans over the age of 70 years old. Now, they may drop the age, so if you're close to that, keep an ear on the ground with this, because they may open that window up. But right now, it's still 70 years old. The VA is offering this vaccine to those that are the greatest risk for infection of severe illness based on CDC guidelines, and will continue to work through their established priority groups. This is not a walk-in clinic. Veterans are not allowed to just show up on the 25th. You must call and pre-register for the clinic for this vaccine administered on the 25th. The phone number to call is 650-496-2535. Again, 650-496-2535. Now, if you are a veteran who is not enrolled in VA healthcare, or you're not sure if you're enrolled in VA healthcare, you need to contact our office, and you could do that at 831-647-7613. Again, 831-647-7613, or online at mvao.org, mvao.org. And we can look at a whole host of different eligibility options to get the veteran enrolled into healthcare. I'll go ahead and pass it over to Jack to give a quick little snapshot on this past weekend's vaccination clinic there at the clinic. Thank you.
Yeah, thanks, Jason, and to all of our supporters out there, elected officials, media officials. Thank you for helping us get this event going. And then, the continued efforts, as Jason said, into the shot clinic that's taking place on the 25th. Yeah, so I was out there on Saturday, the 5th, Saturday the 13th, just to kind of see how the VA was administering all of these 600 vaccinations. And, it was very, very heartwarming and relieving to see it done in a neat, orderly manner. It was everybody was spaced out. They were doing the symptoms checks as veterans came in. They were doing the VA clinic and their staff were doing about 22 veterans every 15 minutes. Veterans would show up, announce what appointment they were there for. They would be directed to specific rooms where the VA clinical team would talk about the procedure of getting the vaccination, potential side effects, things that they ought to be concerned about. Then they would move them to another room. They would get the vaccinations. Veterans would wait there, sometimes with their spouses or caregivers, and they would wait there for between 15 minutes to 30 minutes, depending on any kind of allergies that they might have reported or anything like that. And then after that, veterans got a big patch and an opportunity to take a picture and talk to the media, and then they moved out. And it was an efficient operation. My hat's off to the Major General Gorley VA clinic staff. These types of treatments, essentially vaccination clinics, require a lot of personnel to direct, to manage, to brief, and to actually administer the shots. And the VA clinic here in Marina definitely put its best foot forward in supporting the veterans of Monterey County. All 600 of those shots were spoken for by Friday morning, the day prior. So I expect these upcoming vaccinations to also go quickly. It is notable to say the VA initially had their threshold of age at 75 and above, and then also for homeless veterans and veterans who are medically compromised. About midweek last week, they lowered that threshold from 75 to 70. And I think they tried to mirror, if you would, as much of Monterey County's demographics as possible. I've spoken with Kurt Shockey over at the Veterans Transition Center. They were able to get some of their veterans who met both the age and the homeless demographic requirements to that shot clinic. So everyone's doing their best. And if you haven't registered for this upcoming clinic, I'd tell you contact our office at 647-7613 or contact the VA if you do have VA medical coverage already and you're registered with the VA Palo Alto Healthcare System. Contact them at 650-496-2535. When in doubt, contact our office, as Jason said, and we'll try to inform the veterans as much as possible. But yeah, so all 600 vaccinations went on Saturday, the 13th. It was fast, it was efficient, it was generally painless, and we look forward to having 400 more on Thursday, the 25th.
Thank you, Jack, and thank you both for stepping in and sharing what a great day it was, and talk about precision efficiency on Saturday. It was very impressive. All right, thank you. If you both would stay on the line for some questions after we've got our other presenters. We've got Katie Castagna from the United Way on the line today. She's going to tell us a little bit about the 211 assistance now available for folks trying to make COVID appointments. Hi, Katie. Thanks for joining us.
Good afternoon, everybody. Thank you for having me. Happy to share some updates. As I know you are all familiar with 211, we're a 24/7 information and referral line. We've, since last March, been answering lots of COVID-related questions, of course, most recently related to vaccine eligibility and access. We've been really pleased to be working more closely with the health department to support access to the vaccine registration and scheduling. As we all know, it's in very limited supply and there are some barriers. And we know that people at this point in time to access an appointment, people need to have internet. They need to know how to navigate an online website. And I think it's much easier if you speak English. And we know that there's many people in our community that have barriers that prohibit them from easily accessing those appointment sites. We are supporting the appointments that are listed publicly on mcvaccinate.com. That's the health department website. And it's a little bit of a chicken and an egg, because I'm really pleased to say we have launched the service. We actually trained up a special group of call specialists to help people make appointments and register for them. But that's really contingent on the availability of appointments for us to access. So we did start this service on Monday, and it is available not 24/7, but from 8 a.m. to 8 p.m. And callers have the opportunity to select a particular call queue for the vaccine registration assistance. What I want to be really clear about and ask for your help with is to specify that we are accessing the same appointments that everybody else is, and that if somebody is able to go to the internet and look for their own appointment, by all means, we encourage them to do so. And that this support is for the folks that don't. We just, I was looking through the call log this morning. An elderly man on the peninsula had no internet and called 211, and they were able to help him navigate to his options for appointments. But we're really having to help educate people on the nature of the current eligibility tier. So there's a lot of confusion about that, and we're excited. Today was the start of a new tier. But in our phone queue, like as people call and select the vaccine support, we are repeating what the current eligible populations are, and reminding people who is eligible. And hopefully by the time they get through the queue into the call specialist, we know that they are potentially eligible. But we are dependent on appointments being available. So unfortunately, it's a little confusing or even frustrating for somebody who calls and there's no appointment available. And what we can advise them is to continue to check back. We know that there's sort of a weekly cycle of when the county gets the vaccine and makes the distribution and sets up appointments. And then we also know that periodically appointments do free up because of cancellations. So we are continuously checking those sites and working with people not only for their first vaccines, but we're also helping with the scheduling of the second vaccine. There was a question in the chat about our connectivity today, and yes, the system did go down, but for an interesting reason. Just to tell you all, I think this is affecting all of us, this terrible winter storm. It turns out our calls are routed, at the moment, were routed through Dallas, and they were affected by a power outage there. So we were able to reroute the calls and got the system up and running by about 9:15 this morning. At the start, somebody had asked me, thank you, Victor, how many calls we had logged. By noon, it was about 55 total of all of the calls that we got at 211 today. And then I just checked back, and it was another 10, while we're here talking in this briefing. So calls are coming in at a very quick clip. And I need your help in educating the community that this is a really service support for people that don't have the ability to make appointments themselves through the current online portals. So, and our goal is to have equitable access for everybody that's eligible. And 211 is one of our tools to be able to help do this. So just a couple quick stats. Since we launched, we had about 202 people access that phone queue in the first 2 days, and 176 of them actually stayed on and connected with a call specialist, and we were able to either refer them or make an appointment or ask them to check back at a future date. So I'm happy to take questions, but I am really excited to be able to support our effort in this way. And I think we really need to have all hands on deck as far as helping access appointments as they're available. And I'm confident that as the supply increases of the vaccine, that this will make it, it'll make it easier for all of us, but that as there's more supply, then people will have more satisfaction when they're calling to get that assistance through 211.
Thank you so much, Katie, for sharing that information. And it's great to know all the patience that your hardworking call takers have and listening to all the people and their needs, and then getting appointments such as the gentleman that you described, the real need there for people that don't have internet service to get those appointments. If you would stay on the line, Katie, I know there's probably some more questions for you. We've got one more presenter today, and that's our very own Dr. Moreno, who's going to give us an update. There were some changes in the eligibility that happened today, and then there are also some upcoming changes, and he is going to walk us through some of those. Dr. Moreno, do I have you on the line still?
Yes, I'm here, Mia.
Hi, good afternoon. Thanks for
Hi.
coming back.
Yeah, sure. Glad to be back. Okay, so Mia, what I want to share today is a few things, and Dr. Gus already covered the return to reopening of schools, and again, that's because we're under the new program. The waiver program is gone. We're under the new program, and as you mentioned, any schools that are excuse me, that were already open can remain open. They just have to post their COVID-19 safety plan on their website. And now that our adjusted case rate is below 25, once it's been below 25 for schools that aren't open can reopen with following criteria when the following criteria are met, and that includes the case rate has to be below 25 for at least 5 consecutive days, and the school must, as Dr. Gus mentioned, have to have had submitted their COVID safety plans, and if there's no objection within 7 days by either us or the state, and the 5 day we've been below 25 for at least 5 days, and those criteria have been met, then the school can reopen. Any schools that are interested in reopening and staying open, even if the the case rate exceeds 25, should probably take advantage of this opportunity to reopen their schools. I hope that our case rate does not get above 25 again, but if it does and the school's not open, there will probably be new requirements that the state might implement at that time. What else? Let's see. So as I've mentioned in other briefings, the state's moving to an age-based and health condition-based system for making individuals eligible for COVID-19 vaccine, and that is for vaccine that's allocated from the state supply. Those organizations that are receiving vaccine from a federal distribution may follow different guidelines, but this is for state allocated vaccine. And so we currently have individuals that are 75 and older that can be vaccinated, and that's was intended to start today, Wednesday, hoping that vaccines that were ordered last Thursday would be delivered either Tuesday. That also includes people who are 65 to 74 who are at risk of exposure while working in food or ag, childcare or education and emergency services, and individuals 65 to 74 who are living in the lowest quartile healthy places in zip codes. So that's intended to start today. However, it may not, if an organization has vaccine available in their inventory, and that vaccine was intended for first doses, if they wish, they can use that vaccine. But the orders that were placed last week may not have arrived yet, and so may have to put off vaccinating those groups until the vaccine arrives if they don't already have vaccine in the inventory that isn't already dedicated to other individuals. The reason is because of the cold weather that's hitting most of the United States has delayed the delivery of the vaccines here in Monterey County. And I've just checked with our staff, and we don't have a delivery date yet for this week. But ordinarily it arrives usually Monday or Tuesday. That's why Wednesday, Thursday, and Friday clinics sometimes rely on those vaccines that are coming in. So, hopefully the weather will improve and our deliveries to Monterey County vaccine providers will make it here soon. And yeah, there are some additional changes. We know that the governor did announce that on March 15th in California, individuals who are 16 to 64 with medical conditions or disabilities that put them at highest risk for COVID-19 morbidity and mortality will be eligible to receive the vaccine if their healthcare provider can confirm that they have those conditions. And so those conditions are available on the website, but just to try to quickly go through them, it's individuals with cancer who are in an immunocompromised state, people with stage 4 chronic kidney disease, people who have oxygen-dependent chronic pulmonary disease, individuals with Down syndrome, other individuals that are immunocompromised from a solid organ transplant, pregnant women, individuals with sickle cell disease, individuals with heart conditions such as heart failure, coronary artery disease, and cardiomyopathies, and hypertension by itself doesn't qualify. Also, individuals with severe obesity, which is a body mass index or BMI of at least 40 or higher, and individuals with type 2 diabetes with a hemoglobin A1C greater than 7.5. So those are the conditions that the state has determined a physician must consider in deeming someone eligible to receive the vaccine if they're 16 to 64 and have those medical conditions. So we know that's where we're headed. So we have a group of individuals in 1B that we've been holding off on making eligible. So here in Monterey County, so that we can try to prioritize vaccine, the limited vaccine we have, to those people that are most likely going to die if they get COVID-19. But beginning in mid-March, we're going to have this other group of individuals. So that'll be eligible according to state direction. So what we feel we need to do is go ahead and finish through 1B before we start with the new group that the governor wants vaccinated. So beginning March 3rd, in addition to everyone else that's that's eligible starting today, we'll include everyone else in 1B essentially. So that would be in addition to people who are already eligible today, individuals that are 65 to 74 who haven't already been vaccinated. So that's 65 to 74, regardless of whether they're working in the sectors or regardless of where they live. And then individuals who are at risk of occupational exposure in, again, ag, food, childcare, education, and emergency services, regardless of their age. So that would be anyone who's either 16 or 18 and older would be eligible to make an appointment to get vaccinated. And so we'll have that in effect for approximately 2 weeks before the before the middle of March, when the state when providers can deem certain patients eligible for a vaccine. There are also some other conditions that providers can use it to make someone eligible for vaccine. And those are individuals with certain developmental or severe high-risk disabilities. So those are the other criteria that the state has issued as well. So I do, up until now, I've had a fairly good estimate of how many people are in the phase 1B sectors by age and by business sector. What we don't have yet from the state is an estimate of how many individuals are included in the new group of 16 to 64 with certain medical conditions and disabilities. So hopefully the state will be able to issue some estimates for each of the counties, which can help us, hopefully help us in ongoing planning efforts for our vaccinating Monterey County residents. Let's see, we do have, I do have an update on the Federally Qualified Health Centers program. So we do know that Monterey County clinics will be included among the FQHCs in the United States that will be receiving vaccine from federal allocations. So what appears to be happening is that the the federal government will make that determination and notify the manufacturers of vaccines to deliver a certain amount to each federally qualified health center. So this is rolling out in 3 groups, and Clinica Salud is the first, one of the first in the nation to get vaccine, and that's supposed to happen this week. And then after that, there's another 100 FQHCs at some point that will be added to the program. And then at some point, there'll be a 3rd group that'll be added to the program, and that's where Monterey County Clinic Services Bureau with their various clinics in Monterey County will be receiving vaccine. And we know that it's Moderna that's going to be delivered. It'll be a delivery of 200 to 500 doses each week. And the health centers can use those doses across their different office sites. And but they're going to try to give 100 doses per location, but for now the max would be about 500 doses. So and we do have a little bit of information about the third-party administrator, not much more, but we do know that there's the counties will transition to the third-party administrator provider network in 3 waves. The first wave begins February 21st. That's mostly the San Joaquin Valley counties, and as well as Riverside County and Imperial County. And then the second wave includes Monterey County, San Benito, and San Luis Obispo, and that's supposed to start March 7th. And we do have our meeting scheduled for this week with representatives from the third-party administrator and California Department of Public Health. I think, and then finally, there are some changes to the vaccine allocations moving forward. So the state now is recognizing that most counties are finished or are finishing up with Tier 1A, which are healthcare workers, and many of the skilled nursing facilities and their staff and residents have been vaccinated or in the process of being vaccinated. So what they're doing is they're no longer using the estimated 1A population in the allocation determinations to counties. They're now going to rely mostly on the population, number of people who are 65 and older, and the estimated number of people who are in food, agriculture, education, childcare, and emergency services. And the other thing that we heard on a call, haven't seen it yet in any formal announcement, but what appears to be happening is there's also a change in the way the state will be allocating to multi-county entities and to local health jurisdictions. So previously, up until now, the state has been taking the amount of vaccine that's coming to California that the state can allocate to locals and taking a portion of that and dedicating it to the multi-county agencies, including Kaiser and Dignity and other groups like that. And then whatever's left over gets divided among the counties. And that's the allocation that we can, where we can approve orders to our vaccine providers in Monterey County. It appears that they're going to make a change where they're not going to do it that way. They're going to look more towards the overall population of the county and some formulas that might take into account equity in addition to how many people are 65 and older, how many people are working in the various 1B sectors. And then from there, whatever goes to that county, take a portion of that and then give it to the multi-county entity in some way, but we don't have any details on that. So if they, hopefully we'll get some formal notification, communication from the state on that. That'd be very reassuring. And also, if that's the case, I would hope that we would benefit from that, because we don't have an MCE, we will be getting hopefully a greater proportion of the overall allocation that California has at its disposal to allocate to local health jurisdictions. So I think that's good news. So I'll stop there. Thank you, Maya.
All right, thank you. And we'll go ahead and get started with some of our questions. We've got plenty of questions to take up the last 15 minutes of the hour. We'll start with you, Dr. Moreno. There have been news stories about the hesitation by some Latinos to get the COVID-19 vaccine. Does the health department acknowledge that there is hesitancy among the Monterey County Latino population, more so than with other groups, in getting the vaccine? Do Latinos here have the same opportunity to be vaccinated in the county as other groups?
Thanks, Matt. I don't have any information that would suggest that any particular racial or ethnic group would be more likely to be hesitant to receive the vaccine. I don't have any information here locally that I could use to answer that question. What I do have is some anecdotal information from various employers or representing different sectors of what percentage of their employees aren't interested in getting the vaccine. And I don't remember exactly whom, but thinking about all the conversations that I've been involved with, I would say anywhere from 50 to probably 85, 50 to 85% of employees completing surveys say that they're ready for the vaccine, which means that up to 50% of people in different organizations here in Monterey County, organizations, up to 50% of their employees aren't ready for the vaccine. And that would, that's across a lot of different sectors, which means it covers a lot of different race ethnicities and in those, by those employers. So I think it's, from that, I think that there's some hesitancy across all races and ethnicities.
All right, thank you. And then another question for you here. The state suggested March 15th would allow for those 16 to 64 and pregnant women as being eligible for COVID-19 vaccine. Do you feel this is possible at this time and that there are enough studies to support vaccinating individuals who are pregnant?
Actually the state is following the recommendations from the FDA in their issuing of the emergency use authorization. And in the emergency use authorization and in the subsequent documents that were published and are available for providers and people receiving the vaccine, it states that for both vaccines, that individuals who are older than 16 and 18 for each of the vaccines are eligible to receive the vaccine. And so there wasn't anything that prohibited an individual who's pregnant to receive the vaccine. So that's the guidance that the state and other states in California are following. And as far as I can tell, we'll continue to follow the guidance. There is a mechanism, there are a variety of mechanisms in Monterey County and in California to report for providers and for people who receive the vaccine to report adverse reactions to vaccines. And thus far, I haven't seen any reports either from the CDC or the FDA or California Department of Public Health that suggest that based on those reports by providers or patients who are pregnant, that there's any contraindication to vaccinating pregnant women. So we'll continue to offer vaccine to pregnant women.
Thank you, Dr. Moreno. And I want to go back to the first question that I asked because there was a portion of it that I think you might not have addressed or not specifically addressed. This was about Latinos being hesitant about getting the vaccine. A portion of this question was, do Latinos here in Monterey County have the same opportunity to be vaccinated in the county as other groups do? And that may go to some of our high impact area emphasis for vaccine opportunity.
So I would say there's certain populations in Monterey County that would face greater challenges to get vaccinated when they're eligible to receive a vaccine. So we know that among a lot of Latinos or Latino population are more challenged because they have a variety of social determinants that make it challenging. So they may not have reliable transportation to get to an appointment. They may not be able to take time off from work because they're essential workers to get vaccinated. They may also not be able to complete certain documents to schedule an appointment because they don't have internet access or they don't have an email to receive notification of their appointments. So, I think some of our Latino communities will face those challenges, but we also have other individuals, I think as Katie mentioned, that also are challenged regardless of race, ethnicity. Those are our senior members of our community who have similar issues. It's difficult for them to get out of the house or out of the residence where they live to get vaccinated. They may not have internet access or may not have email accounts or know how to use them to schedule appointments. So I think there's a variety of groups in Monterey County that will have greater challenges to get an appointment. And fortunately, United Way today shared some of the efforts here in the county to make vaccinations more accessible to these type of groups.
Thank you, Dr. Moreno. And then jumping to you, Jason Cameron, I'm glad to see you're still on the line. I've got a question. Do you know how many appointments are left for the Veterans Clinic coming up on the 25th?
You know, actually not yet. We did reach out to ask if they had a number. If we go off of the first iteration of vaccines, it took a little bit of marketing, the fact that they had it to get an uptick. So I would say, if I had to guess, it would probably somewhere in the neighborhood of 300 still probably remaining. But we will get an update on that and get a true number and share that with everybody as well.
And then, Jack, you mentioned a number for the number of veterans who were vaccinated at the last clinic, and just confirming that is 600, where all the slots were taken?
I can say with certainty that all of the reserved spots were taken up by close of business Thursday, early morning Friday. I'm assuming that all 600 were distributed, but I'd have to ask the VA clinic staff about that specifically. And as Jason said, regarding the upcoming clinic, we have asked VA Palo Alto Healthcare System staff to try to provide us with the number of remaining vaccinations, just so that we could continue to advocate for the Monterey County veteran community. And also we've asked if there are any changes to their eligibility demographics. We're still tracking that it's 70 years and above, but there has been some discussion about lowering that threshold. I just haven't seen anything officially yet.
And real quick, I'll just chime in with, don't let the number of vaccines available be a deterrent to calling our office or the VA if you're already enrolled with the healthcare system to schedule an appointment. If we're showing a need, that's how we get more allocated. So don't let that be a deterrent. That number should almost be, not really irrelevant, but it should not bar you from calling. So if you're enrolled with the VA healthcare system, call them to schedule an appointment. If you're not enrolled, call our office so we can get you set up with VA healthcare to get you on the eligibility. So that way we can get you scheduled for that federally allocated VA vaccination. Thank you.
Thank you both. And then Dr. Moreno, back to you with a question. Is Monterey County tracking COVID-19 vaccinations administered to members of the military and civilian employees at military installations in Monterey County? Are doses allocated to military installations part of a federal program, or are they included in the county's allocation?
Thanks, Matt. I don't believe that the state allocation has been used for federal agencies or federal programs, particularly under the Department of Defense or Veterans Administration. I think those are federal allocations. And so we're not tracking that. And I don't know that it's even tracked in the state's immunization registry. What I do have is information that is reported. It's really information that's in CARES is information generally as a result of vaccinations using state allocations. So for example, we do have information on vaccinations in state correctional facilities because the state is using state allocation for that. And so the state correctional facilities have to use the state immunization registry. But as regards to the federal, and CVS, fortunately, CVS and Walgreens and other pharmacies are also using that system. But I don't know, I don't really have an answer for the person making the request, but I could look and try to find some time to look into how the federal allocations for military vaccinations are being recorded and reported.
And I will chime in on that too, Dr. Moreno. The good news on this, as far as a distribution and allocation perspective, is that the veteran population of Monterey County is part of the Monterey County population, which helps the Monterey County get our allocation from a county perspective. So it's almost like we're getting the county population is its own number, and there's allocations that, you know, Dr. Moreno and the health department work for that. Then the veteran population is a new category that's almost, you're almost double dipping, right? So you're getting a federal allocation for the veteran population, but then you're also, the veterans are not excluded from the ask for the county, if that makes sense.
Okay. Great, thanks.
All right, thank you. Thank you all for joining in to answer that question. And then Dr. Moreno, for you, is the vaccine being distributed to enough areas of highest infection, such as South Monterey County?
So we don't have enough vaccine to meet the immediate demand here in Monterey County. So with the limited vaccine we have, we are trying to get vaccine to those that are most affected historically up until now from COVID-19. So in our most recent allocation, we did provide new allocations to some organizations that are providing healthcare to some of the sectors. For example, Clinic of the Salud. So Clinic of the Salud got a bump in their allocation because they are working with the Grower Shipper Association to vaccinate ag workers and possibly ag workers, for now, ag workers that are 65 and older. And we also gave some vaccine this week to Soledad Medical Group and also to United Ag, who again provide healthcare to predominantly ag workers. We also gave a bump in vaccine to Me Memorial, hoping that they would also provide vaccine in a more directed and appointment, using appointments specifically for patients who live in South County. So with the limited vaccine we have, we are directing some of the vaccine to South County in a manner that will be able to get vaccine to the target population in South County. We didn't limit it to ag. We did give a new allocation to, I think it's the Pebble Beach Health Clinic, because they provide services to individuals who are working in the hospitality sector. In this case, it would be 65 and older who are working in the food industry. And so we are trying to get some vaccine to providers who are specifically targeting the higher risk populations.
Thank you, Dr. Moreno. And we want to stop for a minute with questions because Supervisor Mary Adams from District 5 had joined us earlier, and you didn't wave your hand wildly enough for me to loop you in, but you had some comments that you wanted to make regarding access and appointments. Good afternoon, Supervisor Adams.
Good afternoon, Good afternoon, everyone. I just wanted to make a comment. I don't know if you can include this anywhere or not, but I have been hearing from a couple of people, but one couple particularly really hit home. They're tech savvy. They know how to do things. They were calling to get their second appointment, and they simply could not get through the system. They just didn't know what they were doing on computer, and it simply was that they have to use Chrome. And I fear that there are so many people who are going through tremendous anxiety and frustration because they get into the system to attempt to make their appointments, and it simply does not work. And it's merely because they are not using the platform that is most easy to make your appointments on. So as we look toward the calls that Katie is getting at 211 and wanting to make sure that it's people who simply are not able to have internet connection, I want to ensure that everybody understands that if you use Chrome, you're going to have a whole lot more success in getting through and getting your appointment. So that was it. Thank you.
Thank you. And that brings us to 1 o'clock. And I know there are some questions left in chat. I will corral those questions and get them off to the health department and get them back to you as quickly as possible. Thanks very much for joining us on the briefing today. Our next briefing is next Wednesday, and we'll see you then.